right. Hi, how you doing?
Good, how are you?
My name is Mr. Akbar, and I'm your healthcare provider for today.
Okay.
I was asked to complete a head-to-toe assessment from the neck up. Okay.
Okay.
What's your name?
Brittany.
Brittany. It's a pleasure.
Nice to
All
meet you.
right. So before I begin, do you have any pain or discomfort right now?
Mm-mm.
All right. Suffering from any congestion, any kind of illness, anything that's abnormal, out of the usual?
I have seasonal allergies, but I'm pretty okay with them right now.
Okay. So from that standpoint, if anything either hurts you or if you feel uncomfortable, please just let me know,
Okay.
and then we'll make adjustments. Okay.
Mhm.
All right. So I wash my hands. I introduce myself. I told the patient what I'm about to do, and now I'm about to proceed. Okay. All right. So one last thing, ma'am. During this assessment, I'm going to need to touch your face or a body part.
Mhm.
Would that be a problem?
No.
Okay. You always got to warn them what's going to happen, okay? Trust me, I've had bad experiences. So don't just touch on somebody. You're impeding on their space, okay? So first thing I'm going to do is I'm going to take a good look, okay? Now, one thing I want to stress right before at the very beginning is that you don't necessarily have to do what I'm about to do in this order. Or it could be, some things can be slightly out of order, okay? I'm gonna try to go down this order just so you can see what it looks like. But somebody might start with the ears first and then the eyes, okay? Whatever's more comfortable with you. I know for me, whenever I look at somebody, all right, I wanna start off with looking at the full picture, say? So I'm looking at skin, I'm looking at symmetry, okay? I'm looking at if she has any type of identifying marks and so forth. So right now, Ms. Brittany, eyes are symmetrical, nose looks pretty symmetrical, mouth, ears, there's no hanging ears, okay? Which might be a marker for certain conditions, okay? Some Down syndrome, but obviously she doesn't have Down syndrome, but it could be some other cardiac issues and so forth, okay? So we don't have that scenario here, but that's something that you'll be looking out for, all right? And so the next thing I'm gonna do is look at my list right here and color, okay? She's not flush. She looks like she's well rested. She has her natural tone in terms of her face versus her neck. Her arms looks about the same. There's no wide disparity, okay, in its looks. Drainage. If I'm looking at her left and then her right, I don't see any drainage from the ears, none from the eyes. She says she has some allergies, so she could technically have some drainage from the nose, but she doesn't have any at this point. Obviously nothing from the mouth, okay? So those are things I would note, all right, just from my inspection with my eyes, okay? Going from there, I want to inspect some of the sinuses, okay? So typically if somebody has a sinus infection or has congested, the sinuses are congested, when I palpate on the sinuses, they'll tend to feel a little discomfort, okay? I'm not going to necessarily say pain, but discomfort. So I'll take my hands here, okay, ma'am? So what I'm about to do is I'm about to touch on right above your eyebrows, your sinuses up here, okay? Lightly palpate, ask her does she have any discomfort, and right below the orbitals, here, and here. Do you feel any different? Any abnormal
Nope.
signs? Okay. And then I'm gonna look at the ears. Okay. Looking at both her right and her left ear. Any marks, identifying marks, tattoos. And in this day and age, a lot of tattoos on the skin, earrings, If so, what type of earrings? Are they clip-ons? Are there earrings that have holes? And then, if so, how many holes? So she has, looks like 3 in one ear and 4 in the left ear, of which she has two studs in the left ear and then 1 in the right. Okay. Yes.
You don't have to write this down, do you? When you're searching through it. Well, when you're examining her, you don't have to write what you find down.
In terms of the ears and stuff?
Yeah, like moles, ear holes,
I mean,
and
as you
everything.
go.
Yeah.
Typically not, unless it's like something that's like very abnormal. All right. But what I'm doing for you is I'm just speaking out when I'm
Okay.
observing. So you'll see like, okay, well, I noticed she have a couple of earrings here and there, or I noticed she had some people have tattoos on their neck. I'll notice she has some tattoos on the neck, in the neck region, or scars, and so forth. So I'm just letting you know what's going through my mind as I'm going through this head to toe, above the shoulder, head to toe. Okay. External nose. Okay, so I'm looking at the nose area. I'm looking for. She said she had some allergies. Some people would have allergies, they put their nose a lot, or colds. I'm looking if she had any skin crust, okay, around the edge of the nose. I'm looking to see if there's any abnormal color, right? If it's reddish looking, all right, from blowing your nose a lot or something like that, which is not the case with her. Okay, ma'am, so what I'm gonna do, you stay right there, okay? You're doing just fine. I'm gonna, what they call, measure for patency. So what I'm gonna do is I'm gonna press on one side of your nose, and I want you to blow out, okay?
Mm-hmm.
So I'm gonna use my thumb, I'm gonna do on the left side, blow out, okay? On the right side, blow out. So now, the reason why I did that is 2 reasons. One reason is to see if she felt any discomfort when I palpated. Another reason is to see if there was any type of a blockage. So when she blew out, I could feel the air coming out of the open nostril, okay? And that's why I left my hands right here. When I did this, I could feel it, okay? I felt slightly more air coming out of the right side than the left side. So she might be a little bit more congested on the left side, the left nair, okay? Now, by this being my first time with this patient, I can't necessarily say that's baseline, because it could be her baseline. She could just, one nair could be a little bit more open than the other. But I'm assuming it's probably not due to her allergies, seasonal allergies. All right? Trigeminal nerve. So our trigeminal nerve is typically somewhere in the cheek area, okay? So if the nerve is what we call not intact or pinched or not or affected in some way, fashion, or form, that's going to cause some extreme pain and discomfort, okay? Just upon simple brushing or light palpation. So what we like to do is we ask our client clenches her teeth, or his teeth, in this case is she. Would you please clench your teeth? All right. Sometimes that can excite the nerve, cause pain. Other times, you may not even have to clench. I can just do this. Simple brush. Okay, the other finger. Or a swab. A gauze. And it'll cause extreme pain. Did you have any pain on either side, ma'am?
No.
Okay. Thank you so very much. And from there, facial nerves. All right. So what number is cranial nerve? Somebody that's new, not in my class. Cranial nerve what? What's facial nerve? Not in my class. Somebody's in another class, Ms. Van Hook's class. Ramila. Yes. What is the cranial nerve? What is designated facial nerve?
5.
No, that's trigeminal nerve. 7. Yes, cranial nerve 7. Okay, it's facial nerve. So there's a lot that you will experience your physicians doing to measure grossly intact cranial nerve 7. We're only asking you a few of those spots, of those measurements, and those are have you smile. Now, when I ask her to smile, I'm looking for a symmetrical smile, okay? Sometimes with the smile is it's not symmetrical, it's higher, one side's higher than the other, that's abnormal. There's something going on with that musculature, okay? Maybe due to a stroke or something along those lines. I would also ask her to puff out her cheeks without blowing out. So if you can puff it out, sometimes it's good to demonstrate, okay, for your client. So for me, I'll go, would you please demonstrate, could you please do that for me and hold your breath so I don't, and don't let me push the air out your cheeks, okay? Okay, great. Now you did a great job, okay?
Thanks.
Compliment your clients, okay? They need that sometimes. You never know what might be going on in their lives, okay? And then she showed her teeth before, but let me just see your teeth one more time. Okay. When I looked at her teeth, first of all, I didn't see any missing teeth, okay? They looked, a little white, they're pretty in line, okay? Upper and lower. And these are just some of the observations that you'll make when you're looking at the patient. Let me see. Cranial nerve 12. Which one is that?
Hypoglossal.
Okay, so that would be related to like the tongue. So all we asking you to do in this head to toe is do more like a tongue movement. Okay? So, getting back to my patient, my client. So Miss Brittany, would you please move your tongue and I'll demonstrate first. Up and down, left to right. Could you do that for me, please? Because what you might find is that's still so simple, so easy, but some people may deviate. They tell me deviate to one side or the other. Or they may not be able to lift their tongue up, and so that's something that you need to know in order to be able to check off the grossly intact for that particular cranial nerve. Soft palate, that will be vagus nerve, right? Mm-hmm. Okay. And so, simply put, if I had a tongue depressor or something like that, I would open the mouth, and then I would look, see if she has some gag reflex, something like that. I assessed the external ears already, but what I didn't do was assess the cranial nerve for the ears. So there's many tests that we can ask you to do, okay? But for your like the Ryan's test, the Weber's test, but for your assessment, they're only asking you to do one, and that's the Whispers test. Okay? So the Whispers test. Can somebody tell me how to do the Whispers test? Hand on my mouth like this, or something like this, right? Where she can't see or he can't see my mouth moving, right? And what else?
You would whisper like a set of numbers and letters.
So like a series of like several numbers, several letters, right? Alphanumeric kind of a quote unquote code. And then you asking to the client to repeat it. Okay? So you don't want to be like this close to the patient, but you don't want to be way over here either, right? So the rule of thumb is somewhere between 24 inches, 36 inches, somewhere around there.
One, two, three, A, B, C.
Yeah, and if they can repeat it, and then that's good. You go on the other side and you do the same thing. Okay? It's the Whispers test. Now, and the reason why you would do it on the other side is because what if they have hard of hearing on one side? Mm-hmm. But what if they don't even know it? Some people don't even know one side is compromised versus the other. Or what if she has impacted cerumen? All right? Earwax. Okay? And so they may be causing causing her not to hear low frequency sounds on one side, okay? So you always want to test that. Test both sides. If, you want to test both sides, period, okay? You gotta have a comparison, okay? All right, then we got our cervical lymph nodes. So we have 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. So we have 10 that we're asking you to identify, okay? And they're gonna range from this point here to this point here, okay? So I'm gonna start off, and then you gonna help me out, okay? All right, so, you ready? The oracle will be where?
Or right there, yeah, in front of the triggers.
All right, and post
Behind
will
the
be,
behind the like pin or maybe.
okay, somewhere in here. What I try to do is I try to use 1 or 2 fingers, depending on how big your fingers are. And let me just show you. And I try to move like in a circular fashion. 8 times out of 10, you probably can't feel nothing. But there may be a couple. There may be that 20% where you can feel something. If you do, and if it's, and you can have either one or a couple of things happen. It could be movable and non-tender for the patient, or kind of like stationary and tender. Now that last one is like the worst, okay? So sometimes you may have it because someone's sick or in the distress, and that part of that lymph node or a couple of lymph nodes are working overtime to try to kill the infection, okay? Happens to us all. So this is the pulse. What's the next one? Occipital. Where's occipital? So back like your hairline. And remember, you warned them that you'll be touching, right? Face and so forth, right? And so it's still part of that, just checking for your lymph nodes and making sure everything is where it should be. And if it's tender, just let me know. You just reconfirm. You understand what's going on. Next one. Jugular digastric. Jugular digastric. What's that? Where's that? Right here. I don't feel anything. But
You're not supposed to.
I'm not expecting. I'm expecting not to feel anything. But if I do, then that's something different. Okay, what else? Superficial cervical. So what's superficial cervical? Where's cervical? Neck. Okay. What's superficial? Oh, and then ask them if they ticklish or not too, because and let me address this. If a person is ticklish, okay, and it's like in the neck area is one area where someone might feel the tendency to laugh and so forth. Ask them to take your hand, take my hand, hold my hand, all right, and guide me to that area, and then I'll feel. Sometimes when you have them do that, it helps divert their attention from the procedure itself, okay? So just keep that in mind. And also when you're dealing with children, that also is helpful, okay? Have them help you. Help me do this assessment. Can you do that for me? Okay? Super clavicle, where's that? Who's clavicle?
Mm-hmm.
Okay? So now that's when you gotta part ways with some of the upper part of the shirt. If they have a sweater on, they're gonna have to either take it off or open it some. In this case, I open hers up a little bit, and then, and if you notice, particularly for you ladies, make sure your nails are cut low, because when you get down into the clavicle like this, all right, you're gonna have to like do one of these kind of moves. And you see my nails are cut, you know, they cut off, they cut low. So you don't want to be, you don't want to hurt the patient, okay? And so you feel it, you don't feel any, you shouldn't feel anything, but if you do, it could be due to, it could be due to the cold, or it could be due to some type of illness that she's fighting. Next one, submandibular. What would that be? The jawbone, right? So where would it be? Okay. Again, this is when you would ask them, like, if they were ticklish, help me, okay, with this. Should be one. Posterior cervical. Okay, posterior cervical. So we're in here. And what I try to do is like, you see my fingers? I let my fingers dance, okay? I let them dance because, particularly like when you can't really see very well, but you can like feel. I know it looks weird, but guess what? It gives you more surface area to feel and to identify a potential raised or enlarged lymph node. And last, deep cervical chain. So where's our deep cervical chain? So we're going like from like right here, right? Right? I got your books?
Yes.
Right? Okay, all right. Again, let your fingers move and do the dancing, okay? All right, there we go. I know that feels like a massage or something, but I'm not trying to massage, we're just trying to feel for lymph nodes, okay? Now, the order I just did it in is not necessarily the order you have to do it in. Do what's not natural and what's best for you. And that's when I mentioned there is some flexibility in the order that you do it in. But whatever you do, practice and doing it in that same order all the time. Okay, so you don't get off kilter. All right. And trachea. Okay, the trachea is the last part. Now, some people feel for the trachea from the front, others from behind. Okay, so swallow. Okay. Trachea or the windpipe, I felt it. It was right in here. So I had to swallow, and I felt. Okay, and I'm looking for, I'm assessing to see if it's midline or if it's deviating. Okay, on one side or the other. Okay, and that's what I'm looking for when I'm assessing the trachea. All right. So now, thank you very much, Ms. Brittany. It's okay to hold hands, okay? It's called the caring component of nursing. Thank you so very much for letting me conduct my assessment.
You're welcome.
Everything's checked out. Just want to let you know. Well, you have a great day, okay?
Thanks, you too.
All right. Now, I would love for